Welcome, everyone, and thank you for joining us today. We know how precious your time is, so we're really grateful that you've chosen to spend this hour with us. Let's start with some introductions. I'm Sharon Nash. I'm one of the senior consultants here at the King's Fund. My life's work is about leadership and culture transformation, with a particular passion for working with teams. And I'd like to invite my colleagues who are with me today to introduce themselves, Anne-Marie and Hilary. Come on in.
Hi everyone, I'm Anne-Marie Archard. I'm another senior consultant here at the King's Fund. I've been a coach for about 15 years and a team coach for about 6 or 7. And I come to this with the belief that everyone has the potential to be their best. And I take that into both my personal and my team coaching. Pleased to be with you.
Thank you, Anne-Marie. Larry?
Hi, thank you, Sharon. Hi, good afternoon, everybody. I'm Hilary. I'm an associate of the King's Fund, and which means that I also have other hats and day jobs. I work predominantly as a clinical psychologist within health and social care, but I also work quite extensively as a coach, predominantly on a one-to-one basis, but also as a team coach, and hence my involvement with this programme and today.
Thank you both. So today's session is about something quite timely and quite transformational as well. It's about team coaching. And as experienced consultants across the healthcare system, what we are seeing is a real unprecedented level of pressure, staff burnout, fractured communication. And we know that these are not just operational issues, they are human issues. And this is why we're here, really. Team coaching is something that I'm really passionate about because it offers a really practical, evidence-informed way of rebuilding trust within teams and strengthening that collaboration even under pressure, and doing that at the heart of where care happens in teams. So today, what we'd really like to do is to give you some insights, really, into what team coaching is. Anna-Marie, would you mind moving the next slide on for me, please? So by the end of the session, our aim is that you will have a clear understanding of what team coaching is and what it isn't, but also some insight into why does it matter? Why does this really matter? And how does it make a difference in environments like the NHS? And we've also got a guest speaker with us today, Hilary Powell. Hilary is going to share a real world story that brings the impact of team coaching to life. But before we start, we'd like to hear from you. There are about 375 of you on the call. So what brought you here today? What are you most curious about when it comes to team coaching? There is a Q&A function. If you can access that function, invite you now just to put some thoughts, words, reflections in the chat as to what brings you here today and what will be something really good for you to hear as well. It's going to take a minute or two for us to see your responses. So if we go quiet, we're just waiting to see those responses pop up, and over to you. Yeah, and just Kate, yes, the session is being recorded and we will send that out after the session. Thank you. And the slides.
So Sebastian has said he'd like some practical do and don't tips from experienced coaches. So we will try and offer some of those. We'll certainly give you some top tips at the end. Thanks for that, Sebastian.
Okay.
Tracy's interested in some tools. Beverly, curious to learn more about team coaching and how it can work. Practical solutions. A lot of people wanting some practical support.
Yeah.
And getting better knowledge of motivating a team that feels trapped. I think we'll touch on some of these. I'm not sure we'll be able to give you all of the answers in just the hour that we have got together, but we'll certainly start to touch on some of these. But it's really helpful to see these.
Lovely post. Thank you. Thank you. Okay, well, we will come back to those later on, but we're hoping that what we offer today is just an insight, an introduction into team coaching. I'm going to start really by offering a definition of what team coaching is. Anne-Marie, next slide, please. Thank you. So this definition of team coaching comes from Professor David Clutterbuck, who's also real passionate about team coaching. And he talks about team coaching being a process. It's a process of reflection and dialogue, which helps teams to improve performance and the processes by which performance is achieved. And if we were to just to dissect that for a moment, team coaching as a process and how that's experienced is that it's a continuous, structured journey of learning and growth. It's not a one-time fix. It's also a process of reflection and dialogue. And by that, I mean, what we do as coaches, we create spaces for teams to come together, spaces that are so precious because you don't get that on the front line necessarily, and allow them to really deeply reflect and engage in honest and meaningful conversation. It's also about helping to improve performance. And as coaches, our role is really to ensure that we deliver sustainably results that teams can actually improve their performance over time and sustain that as well. And it's also a process by which performance is achieved. And what we help teams to do is strengthen the ways that they work, how they interact together, how they communicate together, how they collaborate, how they embrace and deal with conflict, which is inevitable in any team. And we do that in a number of ways, and we'll come on to that later on in the session. Thank you. Next slide, please, Anne-Marie. So Professor Clutterbuck also talks about the what and how of team coaching. So let me bring that to life with you with an example. So imagine the context of a multidisciplinary team with doctors, nurses, physios, admin staff in a hospital, in a busy hospital ward. And imagine they're experiencing a day when there's rising tension, delayed discharges, inconsistent communication across different services. So the what of team coaching is how we help the hospital team to identify and address the task-related issues, the what. So like unclear discharge plans, inconsistent processes, role assumptions. And we do that through structured dialogue and reflection. And the how of team coaching is focusing on how the team functions together. When a multidisciplinary team, there can often be silos and boundaries that need to be broken down. We do that as coaches by surfacing some of those communication breakdowns, by really thinking about how reactive or responsive decision making enables or disables good outcomes. We look at issues like conflict avoidance and how is that helping the team to be more cohesive together. And we do that in a way that builds trust, in a way that builds inclusion, and in a way that builds a shared responsibility. And there's also a systemic context to this. If we think about, if I think about how teams work together through the team coaching process in this particular scenario, it'll be about understanding actually, the pressures that we experience are not just unique to us. They are, external pressures as well. Bed shortages, staffing gaps, policy constraints. That's experienced across the whole system. So we help them to think about how can they collaborate more effectively within the broader healthcare system. So in summary, team coaching is not just about fixing the discharge process, which is the what. It's about transforming how the team thinks, how they communicate, how they collaborate, the how, so that they continuously improve even in a complex healthcare environment. Next slide, please, Anne-Marie. Thank you. Anne-Marie, do you want to just give a few insights into how team coaching differs from one-to-one coaching and other forms of development?
Yeah, thank you, Sharon. So as a coach, but also a facilitator, I think there are times when we get invited in to do different pieces of work. And the difference in terms of what a team coaching offers rather than perhaps other forms of facilitation is that it tends to focus more on the dynamics of the team, how you work together. It can have an element of one-to-one coaching within it. So quite often when we're invited in, we might be doing some specific coaching with the leader of a team, as well as then working with the whole team in a collective, because a lot of the issues that teams have tend to revolve around the leader and the leadership role. That's not to say that the leader is the cause of those issues, but actually you know, people to look to the leader for solutions, for problem solving, and things are often located within the leader by the rest of the team. So I think it's really important that we think about that and how that works. So there's something about how we work with others. We in team coaching, we really focus on how you work on morale and team bonding, how you collectively focus with each other. So there are some different things in this in terms of what you might sort of think around how you work with others versus what sort of sits here in just in a one-to-one coaching environment or a team building coaching environment, that we are focusing on the whole and those dynamics. And for me, there's something about how the link between the two is about task and relationship, because when we're focusing on team coaching, we're focusing on both those elements. As Sharon has just sort of said, we're focusing on what the team is doing, the work that is doing, and the relationship that holds it all together. So that's slightly different to these elements here. So you will see that we see the team as a system. Facilitation could be something like a half-day away day rather than a longer term relationship. So again, team coaching tends to have a much longer term lifespan with a team, normally over at least 6 months, sometimes over a year, and can be even longer. So it's just sort of think of those different elements. So we pull, I would say, from all of the other elements of facilitation when we're also focusing on team coaching, but we package them together in terms of being really responsive to the context and the environment the team is working in.
Thank you, Anne-Marie. And Larry, I'll invite you to come on in if there's something that sparks or resonates with you as well. But what resonates with me is, you know, the sense of wholeness, and you have a complete team, which is a system in itself with its own unique culture, with its own unique ways of doing things, but it also could be a microcosm of the wider system that it exists within. That really resonates for me. So now we've kind of given you some definitions and given you some examples of how it differs from other team development initiatives. Just like to share some insights into why do teams get stuck, and why does that matter in a high pressure environment? So Anne-Marie, can we move on to the next slide, please? Thank you. So in my experience, you know, even the most capable teams get stuck from time to time, and they get stuck when stress, lack of clarity around roles, and how trust disrupts how they work together becomes an issue. And in high pressure environments like the NHS, like health and care, these challenges are really magnified by urgency, complexity, and emotional strain. And it really can have an impact on how the team functions together and how they interact together and how they perform. And ultimately, what we're talking about here is an environment where teams can thrive in a way that patients get the best possible experience. But the reality is that there is stress and overload in the system. We see it every day. And when that pressure on teams often shifts into survival mode, what happens is decisions become reactive, not reflective. There's little time to pause or think even. Lack of clarity around roles can result in people not knowing what task am I supposed to pick up. Things get missed or they fall through the cracks. And confusion starts to breed frustration and inefficiency. We know that low trust is also an issue. And when that sets in what we actually see is people stop speaking up, but things get missed, mistakes are not really reported. And instead of healthy challenge, there's silence and collaboration starts to unravel. And then ultimately that leads to burnout, where that constant emotional strain wears people down. And when energy and empathy runs low, so does a team's ability to connect, to support each other, and to stay resilient. And there is a cost of staying stuck, you know, that miscommunication, mistrust. It leads to errors, it leads to inefficiencies, it leads to disengagement. And as burnout continues to increase, morale drops, and we see turnover rates going up. And most importantly, the quality of the service and the care that we give suffers as well. So that for me is actually it's really important for teams to understand or notice when they're getting stuck. And we'll share some insights with you at the end of the session as well around that. So why does it matter in high pressure environments? We move on to the next slide, please. Thank you. So in high pressure environments, what we know is that there is pace, speed, targets to meet, reports to write, all of the things that you face in healthcare every single day. And that constant pressure really pushes teams into survival mode rather than thrive mode, where short-term fixes become the norm and cracks become costly. When pressure exposes those cracks, what happens is quick decisions with limited information results in emotional fatigue and burnout, and reflection and innovation stalls. And what I see is teams just trying to get through the day. They're not actually thinking about how to enjoy the day. They're trying to get to the end of a shift. And that reflection and growth stops. And burnout becomes a real issue. It's not an issue just for individuals, it's an issue for teams as well. When we notice those survival mode symptoms in play, we notice more silent working, more reactive working, more risk averse teams. And there's a focus on coping, really coping, but not really thriving. And with the best skills in the world, I've seen really, really competent teams, really teams who've had excellent results, who actually falter under these conditions. And the way that team coaching helps, team is about taking people out of the pressurized environment, creating a safe space where they can have honest, open conversations, where they can reflect on what's really happening in the team, how they're working together, the difference they're making, the care they're providing, what makes that difference. We explore things like conflict. How do we have healthy conflict in a team that doesn't derail that sense of trust and psychological safety? How do we then hold each other accountable and commit to actions which we know we're going to follow through on, which are going to deliver the results that we need? And for me, team coaching, it is essentially about allowing space for people to breathe, to reflect, but we do some real tangible work within that space as well. Next slide, please, Anne-Marie.
Can I coach my team? I think you can, but I think it is difficult. I think it's easier if you are outside and independent. But I also think that you can use some of the principles. So don't feel that you can't try and do it, but actually that independence can help as well. And partly because, as I've said already, when we come in and work as a team coach, we do spend quite a lot of time with the team leader. So you're a bit conflicted if you're in that role and trying to coach others. So it can make it harder for you. But I wouldn't want to say to people you cannot do it. OK, but for us, we would say we would be able to come in and give that additional support to both the team and the team leader. We really want someone who's going to focus on you and building and maintaining your relationship. So actually part of what we do is get underneath the skin of the relationships. Where possible, we have conversations with the team, some individual members as well as the team leader, to try and understand what are the dynamics that are happening in the team, so that we can really then come in and work with you and help think about what you might need around building and maintaining those relationships. And if you are acting as that team coach, it's really important that you use yourself. And I think one of the things that is often easy to underestimate is how much we use what we are picking up in the room as a coach from the dynamics in the team, sort of what we feel, what we see, what we experience. So you managing and using ourselves. If I notice some uncomfortableness that I'm feeling, it might be something that is going on for the group. It's going to be a dynamic, not necessarily something that I own. So we really have to pay attention to that, and then really think about the context. What is going on? And I think that's one of the most important things when we're working with a team and doing some team coaching is, the environment that you're working in, all the other interrelationships, what's happening in and around the team. It's context specific, and the team will bring that context. It's important for coaches that we help unpack that for the team and help them understand the context that they're working in, because sometimes they miss things. They just think this is how we are. An example that might be of that, working with A&E or ED departments. Often they are some of the teams that we get invited in to work within, because they feel like they're struggling, feel like they're under pressure. And actually, that's because they're holding that role for the whole organisation. They're the front door. They are the pressurised service that people come into. So it's sort of seeing how a team might sit in an organisational context, and we can bring some of that insight. And then, of course, the process. And we've heard a little bit about things like Lencioni as a model. Other models that sometimes can be really helpful, Tuckman, his forming, norming, storming and performing, a reminder that is just a really helpful frame to think about how teams function and how they come in. So we'll try and bring in some of those models, again, depending on the context for the team. So our 5 top tips that we're going to leave you with before we take on some more questions is, the first one is, if you're thinking about team coaching, is to check that you are ready for this. Do we feel like we're a real team? As Sharon has already said, have we got a shared purpose, shared goals? Are we ready to do some reflections and not just to react? Often it's safer to stay in action. People want to be doing things, and it can be more difficult to move into that reflection space. So giving people time and space to do some reflection. Are you ready for that? And it only works if the team leader is there and willing to show up as well. It's going to be, it's personally, I would not go in and work with a team where the team leader felt this was being foisted upon them. And I think that would be worthwhile having a conversation with whoever thinks that team needs support to say, how are you going to work with the team leader first and foremost before you go in and try and do anything with the team? Work on how you work. So, think about the hidden patterns, communications, what's going on in the decision-making process. So we spend a lot of time, not only us thinking about what's going on in the team, but helping the team to see it and recognise it when we're doing team coaching. Noticing the behaviours that are going on even in the room when we're working with them, and also what happens when we're not in the room working with them, because we will be with them as team coaches for such a short period of time. What we want them to do is to really step in and really think about what's going on for them outside. And then, I've already talked about the importance of reflection as a habit, but I think if you can hold some space to reflect on how you have behaved, your impact on others as part of a team, the challenges that you're facing, and you can feel, enter into those sort of spaces as brave spaces where you can talk to each other about some of those. So once we've built that psychological safety, how does that work for you? And building psychological safety, building trust, it's a muscle. You have to keep working at it. Particularly, teams are not static things. People come and go. Organisational context changes. Services get redesigned. So we have to really think about, as those things happen to us, as a team, we've got to continue working on that trust. It doesn't just appear. We have to be willing to be open, vulnerable, have courage. And what we try and do is create the spaces where people can start to enter into those conversations and feel some discomfort, because it's not always going to be perfect. And actually, the team that you work with, they're not always going to be people that you would want to be spending time with outside of work. So we have to recognise that we have to build working relationships that are going to enable you to work together. And then the last one is connecting the team with what matters most. Don't lose sight of that bigger picture. What is it that you want to achieve? How are you aligning that to the goals of the organisation? So it has to be based in the real work that you are doing. So I hope that's helpful in terms of 5 top tips to think about as you're perhaps considering entering into team coaching yourself, or thinking about the sorts of things that you might want to do if you are trying to coach a team yourself. Thanks, Sharon.
Thank you, Anne-Marie. And actually just pick up on that last point in terms of connecting to what matters most. And it actually probably connects to a question in the chat. The Team Dynamics program that we run, it has a container, it has a loose structure around it based on the Lencioni model. But actually, we don't follow that structured process rigidly. We work with what's real for teams when they come to us, what's really challenging for them, and we just use that as a framing to help us to have some structured conversations and unstructured conversations as well. So I'm just going to take a few more questions. Thank you, Joe, for the endorsement of the Lencioni model. Question from Becky. How does team coaching work in practice? Is there a coach in the room asking coaching questions of the group, or is the coach facilitating coaching-based activities? So I'll build on what I've just said, and I invite Anne-Marie and Hilary to add to that as well. You know, the way we coach is online predominantly in terms of the team coaching program that we run here at the King's Fund. And it's not about asking questions, it's about engaging the team in a process of inquiry. What are they curious about? What do they want to inquire into? We use a range of techniques and tools to uncover then what are the real issues that need to be addressed. And then we work with the team through dialogue, conversation, as you know, really bringing to life conflicts that happen in the team, real issues that we can then engage the team in thinking about how do we solve this for ourselves. So we're almost there as enablers of that thinking. We're there as thinking partners as well. We're there to challenge. We're there to intervene. But it is not a kind of it's not the same as one-to-one coaching where the coach is asking questions and there's and to me for me actually one-to-one coaching is more of a conversation. I would say it's more of a group conversation, really grounded inquiry. What are we curious about? Let's have a conversation about it. What can we learn together? Hilary or Anne-Marie, anything to add? Come on in. I'm just going to look at some of the other questions while we're doing that.
So I think for me, sometimes we do use powerful questions as you would do in a one-to-one coaching environment, but it's actually inviting perhaps others to think about how they would use them as well. So we might invite people to perhaps be a little bit more try open questions rather than closed questions. So we do use, I would say we use a lot of the skills that you have as an individual coach, but actually you are also looking at the dynamics of the group or the team and working with them, following their collective interest, noticing things and picking things out perhaps for the group that they might not have seen. So I think you use many more of those skills. Hilary, what about for you?
Yeah, no, I agree with what both you and Sharon have said. I mean, on the issue, you know, if we look at kind of the core of the coaching skills, kind of asking powerful questions and listening, I think one of the things that's really valuable about team coaching is that it gives everybody in the team the opportunity to develop indirectly their own coaching skills for the reason you just said, Anne-Marie, you know, that, you know, as a team coach, you still ask questions, but you encourage that dialogue between the team as well, and encouraging people to really understand how different and often an impact it can have to ask these open, powerful questions, but also how powerful it is to listen and feel heard. You know, sort of people mention time and time again, because it is prevalent, how burnout is affecting people. And a lot of that, you know, burnout, as we know, is linked to kind of occupational stress. Is, you know, that is what it is. It's job related, and one of the things that people can benefit from, as you rightly said, is not just being at the receiving end of these powerful questions, but really feeling heard. So as a team coach, you're almost modeling skills that people can then develop themselves, and certainly hopefully the team leader carry on. And yeah, I see how valuable coaching is as part of a leader's repertoire.
Thank you both. I'm just going to move on to another question, and this is quite a big question actually. How can you improve psychological safety in an organization that's facing 50% cut in workforce, like all ICBs, and everyone is in survival mode? I've been in that situation myself quite a few times, and the most powerful way that I know to start to create that psychological safety is for people to feel that they are heard. There's a really good model called the Bridges Transition Model, which I use a lot, it starts with helping people to think about, okay, as a result of this change, what am I losing? What do I need to let go of? Because until people can really accept and acknowledge that, it's difficult to move on into that space where a transition happens. And in listening and allowing people to be heard, I've always really emphasized to senior leaders to listen without the need to respond, but to listen at multiple levels as well. In the pandemic, this was done really well by a trust. I can't remember the name of it, but they did some listening exercises, which actually translated into how people want to be treated as human beings. And in that listening, it's about listening at three levels: listening for what is said, listening to the meaning behind it. So that's the level 2, but then also listening to the emotion, because that's where you find out what people are most afraid of, what they're most afraid of letting go of: status, relationships, connections, all of those things that are really important to us. Anything to add, you two?
I think yeah, sorry, Emily, you go ahead.
Well, I was going to build, because I think the William Bridges model, where he talks about ending well, and I think it's one of the things that we don't tend to do in health services. Stuff just gets moved into the next iteration. So actually, if you're recognizing that team is going to have to reduce, and that some people are going to have to find new roles or leave the organization, it's maybe to sort of just recognize what you have achieved so far. And I know that can feel difficult, to be looking backwards when everyone is anxious about the future, but actually a moment to sort of consolidate and say, look, we know that change and transition is happening. We know it's beyond our control, but actually let's just recognise the things that we have managed to do whilst we've been here collectively, before people start to disperse into those new different elements. And it can be a way of grounding us. So I would say pay some attention to the endings, as well as thinking about what's going on for the beginnings. And then I also think there's something about leaders being as honest as they can be, because often we are fearful because we have information as a leader that you cannot necessarily share with others. So be honest and say, look, there is information, but I cannot share it with you at this point. But also you could, people being able to share, again, it goes back to that psychological safety. Can we create the safety where senior leaders can also say, look, I'm a bit anxious about what's going on for my future, or I'm concerned for you. I'm trying to do my best for the people who work here. And I know a colleague was working in coaching a chief exec who was going through a large transition where they were reducing a number of teams. And he said she got out there every day and she was leading discussions about the transition. And then she went home in the evening and she cried her heart out. So to recognise the emotional cost that it can have on us as leaders as well. So I hope that's helpful, just thinking about some of those. It's not an answer. Nobody's going to help motivate the team, but actually what we can do is be human to each other, I think, and that's where this starts.
Yeah, absolutely. And at a time when you might think, well, is it worth investing in psychological safety if this is a team that's coming to, actually I'd argue it's more important than ever, because as Anne-Marie said, obviously maybe leaders can't share everything, but be honest about that. Transparency matters, and you are again modeling that it's okay to be open, and by fostering that sense of safety and trust, even though it might seem like everything is crumbling around you, it will create an environment that is far easier for people to come and raise concerns and share their, what's going on for them, and ask questions, because the key thing is being able to ask questions and make comments, etc., without fear of repercussion.
Thank you, Larry. Thank you both. Megan, please get in touch and we can talk to you about different options for charities. We've got a couple more questions. How do you assess if your coaching program is successful? Do you have a process or assessment tool that you use? And what are you trying to measure? Example, burnout, team cohesion, and something else. Who'd like to take that?
I'll start and then you can come in, Sharon.
Yeah.
We don't have a specific tool because each team is different. So it goes back to agreeing the purpose of the team coaching with the team. Really, it's about contracting. So as coaches or as facilitators, we spend a lot of time thinking about what's the initial contract we're making with the team. So it's agreeing up front, what is it that the team wants to focus on? And therefore having that as a baseline that you would then come to at the end to say, actually, how have we gone? How have we managed to get there to this point? Have we achieved what you wanted to achieve? But I would also recognise that those goals can change over the course of the work, because teams can come in with one thing, context comes into play, something else comes across their agenda, and so suddenly there's another thing that they want to work on. But generally it tends to be about people wanting to improve their relationships and their effectiveness as a team. And so we would ask them to talk about what the team is like as they enter into it, and then at the end ask them to do some sort of personal reflection on how it feels now. So those are the sorts of soft metrics that I would use.
Yeah, and an example from a team that I've just worked with, you know, at the outset, I asked them to really outline what would a successful team coaching intervention look like for them, rather than impose measures on them. And they came up with some real tangible stuff, like, you know, our team meetings are more effective. You know, we start on time, we end on time, just simple things like that. Or we spend more time in reflection than we do in reactive mode. Or actually we look out for each other more, and we check in with each other more. We have a different way of addressing our meetings. So for me, that those measures need to be real to the issues that people bring in the first instance. I've got another question here. In a team of over 80 staff with several leaders and recent integration, how do we start with having such a big team and working over several sites? And there's more. Any models or suggestions to get started? I suppose the first thing to say that team coaching in the way that we engage in that in the King's Fund, we tend to work with smaller teams of up to 8 people, and that way we know we can really engage the team both individually and collectively. Looking at a larger team, we'd have to talk about actually what is it that you're trying to achieve together as a team. There may be some ways of thinking about how you collectively as a team really align around a shared purpose. But I encourage you to get in touch, because that's not a question that I can answer fully. But we would say the work that we do, we work with smaller teams, but then we also have done work where we roll out that team coaching program for wider teams, for wider organizations as well, but we do that a team at a time. Okay. Just another question that's popped in. And in a team, how do you make sure everyone's voice is heard? Larry, that sounds like one for you.
I think it's critical as a team coach to make sure that everybody's voice is heard. You know, invariably, as we've touched on earlier, you will have some people who are very happy contributors and very open, and then, you know, extroverts, and others who are perhaps a little bit more introverted. But I think it's you know, as I think was also touched on earlier as well, the thing that I found very different, if you like, with team coaching is you have to be even more nimble and, you know, watch what's going on in the room. It's not just obviously about what's being said, but and whereas with one-to-one coaching, yes, of course, you look at the body language and tone, etc. But now you have to do it with a group of people. So constantly looking out for signs and bringing people in without making people feel pressured to contribute is critical. But I think, again, going back to what we've been saying as the theme of the day, almost, of the more you as a team coach can also create a sense of safety and trust, the easier it will be. And I always think it's, and maybe this is part of the evaluation as well in a qualitative sense, but I always find it really joyful to see as the work progresses. The most recent team I worked with, the 2 quietest people in the group were the most vocal towards the end, and actually one of them took on the task of, you know, the creative task of building an artifact to represent our journey, our learning journey. They actually led that session. So yeah, it's an investment that's worthwhile, and it's just important to keep just paying attention to it, and that fine balancing of not pressurizing people, but it creating an environment and an atmosphere that invites their input.
Thank you, Larry. And I would just add to that, you know, as coaches, our role is to deploy techniques that allow everyone's voices to heard, to really embrace the difference that shows up in the room. And for that reason, we use a number of techniques. We might invite people to journal and feel safe to share what they've journaled with another colleague. So in pairs, we might break down larger groups into small groups, so everybody has an opportunity to contribute. We do a range of things, but I mean, our absolute aim is to make sure that we get a collective voice, and we do that in many different ways. We've got time for one more question. Let's just have a quick look. As a coach, do you call out negative type non-verbal body language between individuals? Anne-Marie, that sounds like one for you.
I think it always has to be in service of the work and in service of the group. So I wouldn't want to out somebody just for the sake of it. I think you would have, but what you can do is bring in your superpower as a coach, and one that we can all use, which is our noticing. So you might say, I noticed there seems to be some interesting body language between you. So you could use something like that, which can be quite a soft way to bring it to the attention of the group. But as I said, it's always done in context. So I wouldn't want to just say, yes, I would always do that, because I would want to look at what was going on in the room, the conversations that have happened already. Somebody might have some body language, but that it's there for a very good reason, that you might not want to highlight. But yes, you might notice if somebody is constantly facing away from somebody else or not looking at them, but you might want to bring it into the group as a whole. You might want to invite them in to say, I'm noticing that we have some different, types of body language or different types of attention. What do you notice? So then you're not necessarily calling any one person out. So those are some of the things that I would use, and curious to hear from my colleagues as well.
No, yeah. I agree with you. I'm sorry, Sharon.
No, you go, Larry.
No, I agree. I mean, you've got to be so careful in kind of giving feedback, especially publicly. I think if something feels quite extreme, or I'm noticing that somebody's disengaged and maybe even kind of a bit distressed, obviously, as a team, as I would have done as a team leader, I would, even though this is a team coaching event, I would still think, take some conversations offline just to check in. But yeah, certainly making it kind of quite a neutral and just observing behaviors. So some of the classics there around how to give difficult feedback, focusing on the behaviors rather than generalizing it as a kind of personal thing, is always helpful. But I think actually being willing to challenge and be clear about what we're observing, even in a way that is kind of, I'm curious here and can we explore this, is actually not just very powerful within a team coaching intervention. I think it actually again reinforces the importance of psychological safety, that people can actually be candid, that they can raise something that's a concern or a discomfort, that I have a difficulty with you. And I remember in one team, the issue had been one member was really concerned that somebody had taken something away negatively, but they opened up to each other and had the conversation, and actually a lot of assumptions had been made that this had been a terrible thing and it hadn't been received that way. So actually, by calling out, for want of a better phrase, or observing these things, what we're doing is helping people to understand as well that there's a difference between intention and impact when it comes to communication.
So. Thank you, Larry. Thank you. And I'd also just emphasize actually that that's the work that we do at the beginning of the coaching engagement to build that psychological safety, and to be really explicit about how we will intervene when we notice some of these dynamics in play. We come to the end of today's session. Thank you so much for your questions. It's been a pleasure to have you. Just the last moment reflection for me, if you're thinking about team coaching, don't think about it as a quick fix. It's about creating conditions for your team to thrive under pressure. And it's grounded in psychological safety. We talked a lot about psychological safety today. It's grounded in reflection and shared growth. So you need to be able to come to that with a willingness to invest emotionally as well as otherwise in this. So if today's session resonated with you, please do get in touch, and our emails are up there, mine and Anne-Marie's. But also you can learn more about a Team Dynamics program by going online. And I'm going to ask Nazim just to post that in the Q&A so you've got the link to that. But otherwise, thank you for joining us today. It's been a real pleasure, and we hope to hear from you soon. Thank you.
Thank you.